I use research and evidence-based practice to improve patient care.
Especially in the nursing field, that's a lot of the ways that we do things is evidence-based, and it all stems from research. So to better understand what we're doing in the nursing field, we have to use research to apply it, and then it's also used in order to improve the way that we take care of patients, or even the way that we learn.
We had a research class this semester that taught us how to read research articles, and I'm very grateful for that because now that I have that knowledge, I can go through articles and find evidence for practices that are best. And the thing with nursing is that it's constantly evolving and that we have to adapt and adjust our practices to what the best and most recent articles and research are showing. So I would say in the short term, I use research as a student to further develop my knowledge and try and become the best nurse I can be.
What I'm encouraged to do is to see what kind of research is out there. We have a lot of good doctors that are involved in our education and CRNAs, and they'll often point to a study that they can think of off the top of their head, and we'll go over that and find what the latest and greatest idea is about that particular topic.
I think with all the committees and project changes that we do for our patients, we need evidence-based practice to provide the data neat as to how to impose the change. So we really use it in almost everything that we do.
In care coordination, we work with a lot of patients with medical complexity, multiple different issues going on. We use research frequently to provide education with whatever affliction that they may have, multiple illnesses, injuries, and so forth. And we're constantly using the research to educate not only ourselves but our patients as well.
As a student, I use research and evidence-based practice to utilize it in clinical and just make sure that I'm giving my patients the best care.
Well, everything we do is research-based, but I'm pediatric, so we do vaccines all the time. So it's constantly changing how we do vaccines because the recommendations are changing based on research.
I'm in administration, and so one of the things is that nursing practice changes so rapidly these days. One of the areas is how do our nursing programs stay in tandem with or alongside what's happening in practice. And that takes research is a big part of that. Certainly we listen to what practice tells us they need, but then we also use the research to give us support for either new programs or program curriculum changes or other areas we have to work on.
Well, I look to research in a lot of areas of my work. I'm a registered and certified clinical aromatherapist at Gunderson, and so I lead the essential oils work that we use with patients. And it's through that research that we are able to really help understand what essential oils we want to use to help support patients that are experiencing anxiety, nausea, and pain, and use them safely. Because there's a lot of information out there about essential oils, but it isn't always correct information, and it's the research behind it that helps me create a good program.
Innovation.
Exploratory.
Practice.
Innovation.
Evidence.
Enlightening.
Important.
Forward-moving.
Innovation.
Knowledge.